I'm going to tell you how to recognize and survive a heart attack. Paying attention during the next few minutes could save your life. The greatest health problem facing the U.S. is the huge number of heart attack deaths. The American Heart Association reports that just over 1 million people have heart attacks each year, and that nearly half of these patients expire in the acute phase of the attack. 2/3 of these deaths occur before the patient is admitted to the hospital where life-saving treatment is available. This number of deaths outside the hospital remains unchanged year after year. Heart attacks usually produce early warning signs, and if they had been learned, many, if not most, of these patients could have gotten to the hospital in time. In Missouri, they were successfully taught getting patients to the hospital sooner and in greater number. Heart attacks are caused by a blood clot obstructing one of the 3 matchstick-size coronary arteries nourishing the heart muscle. The blood clot begins in a small crack in a thin layer of cholesterol deposited in the wall of the artery, gradually increasing during minutes, hours, or days, meaning that heart attacks are usually not sudden, but develop over a period of time, often producing forewarnings. If the artery becomes completely obstructed by the blood clot, the heart muscle supplied by that artery begins to die in 1 hour, and death is complete at 3 hours. Your odds of surviving your heart attack depend directly on how much heart muscle is saved by treatment. If blood flow is restored to the affected heart muscle before the end of the 2nd hour of your symptoms, most of the muscle can be saved. Now I'm going to tell you how you can obtain life-saving early treatment of your heart attack. First, you must learn the early warning signs of a heart attack. They are the same for men and women. 2/3 of patients have discomfort in the front center of the chest, a feeling of pressure, fullness, squeezing, aching, or burning. It is usually mild at the beginning, but may increase and may spread all the way across the chest. It frequently extends into one or both arms to be mistaken for muscle strain. It frequently extends into the neck or jaw to be mistaken for a dental problem. It may extend downward into the upper abdomen to be mistaken for hiatus hernia discomfort, acid reflux, or simple indigestion, and be treated with multiple doses of antacids. Many patients have discomfort in the center of the back between the shoulder blades, usually wrongly attributed to arthritis, muscle strain, or simply my aching back. All of these early warning signs, or any one, may occur without there being any discomfort at all in the front of the chest. In fact, 1/3 of heart attack patients have no chest discomfort. Once any of these early warning signs appear, you must seek immediate attention. Your first step should be to call your doctor if he or she wishes to be contacted in a heart emergency. You should ask about this during a routine office visit. If your doctor is not immediately available, or wishes not to be called, you should chew and swallow a regular aspirin and get to your nearest emergency room by the quickest possible means. A large federal study showed that 76% of heart attack patients in the study went to the hospital by car, 16% driving themselves, and 60% being driven by others, 23% calling 911 for an ambulance. A large Salt Lake City study showed that heart attack patients going to the hospital by car got there 29 minutes sooner than patients transported by paramedic-staffed ambulances. Another large study showed remarkable safety of heart attack patient travel by car. If you seem severely ill or have no other means of transportation, you should call 911 for an ambulance. If you go by car, you should sit erect because lying flat causes heart attack discomfort to worsen. If someone in your presence becomes unconscious and has no pulse, you should call 911 and immediately begin forcibly compressing the chest once per second until help arrives with a defibrillator. Do not use mouth-to-mouth breathing. At the hospital, you must tell the receptionist that you think you're having a heart attack and must have immediate attention. Many heart attack patients have expired as a result of being put aside in a waiting room. Don't let that happen. Inside the emergency room, you will be given an electrocardiogram heart tracing within 10 minutes, enabling the emergency room physician to quickly determine whether you're having a heart attack, and if so, what treatment is best. The majority of patients with the most serious form of heart attack are treated with fibrinolysis clotbuster medication to dissolve the obstructing blood clot. This is given by injection in an arm vein and can be carried out within the first 30 minutes of your hospital arrival at any hospital, often sooner. If this is given during the first 60 minutes of your symptoms, the golden hour, deaths are cut in half. The second choice of treatment is compression of the blood clot by balloon coronary angioplasty in the cardiovascular catheterization laboratory if your hospital has such a lab. National standards call for this to be underway within 90 minutes of your arrival. Severely ill patients are not suitable for fibrinolysis and should be treated by this method. A study in one U.S. hospital showed that 9% of the patients in that study treated with angioplasty received it during the first 2 hours of symptoms, whereas 30% of patients treated with fibrinolysis received it during that period. A study involving hundreds of hospitals showed that 39% of the thousands of patients treated with fibrinolysis received it during the first 2 hours of symptoms. This information will enable you to quickly recognize whether you are possibly having a heart attack, how to get to the hospital promptly, and how to choose the proper treatment. It can save your life. Your goal must be to obtain treatment before the end of the second hour of your symptoms, ideally during the golden hour. Take it to heart.